Mads Gilbert, who's a professor at the Clinic of Emergency Medicine at the University Hospital of North Norway. Welcome to the News Hour. Now, you have worked a lot in Gaza, the hospitals in Gaza. Just your reaction to these findings that now there is the poliovirus found in Gaza sewage samples.
Well, it is very grave. It's extremely serious and unfortunately not unexpected. We've already seen a widespread epidemic of hepatitis A as a result of the Israeli occupation forces' siege of Gaza, the lack of water, sanitation and food. And now polio type 2 virus has been found both by WHO, UNICEF and the Palestinian Ministry of Health and the Israelis. And this is an extremely contagious virus. It was actually declared eradicated 25 years ago. And I think it is a very stark symbol of the Israeli brutality of the occupation that poliovirus now comes back 25 years after it was declared eradicated as a result of the destruction of the sewage system, as a result of the piling up of hundreds of thousands of tons of garbage and the destruction of the healthcare system. Now, most of our kids, if not all of our kids, will be vaccinated with the weakened poliovirus. So the vaccination programs has also. Yeah.
Mads, my apology, you just cut out there. Just for clarity, you were saying that most of the children would be vaccinated against the poliovirus in Gaza. Is that what I understood? So they are vaccinated?
No, the point is that before this last attack, the health authorities in Gaza had a very good disease surveillance system and a very good vaccination program. But the vaccination program needs an intact healthcare system, a primary healthcare system where you take your kids to the mother and child clinic and you get the vaccinations. And to have polio vaccination, you need a shot at 2 months, at 4 months, at 6 to 18 months, and 4 to 6 years. So the 50,000 children that have been born in Gaza during the Israeli attack, only a fraction of them have been vaccinated. So this adds an extremely high risk of contracting poliomyelitis because such a small part of the newborn are vaccinated. And for the others who were vaccinated before the attack from the Israeli occupation forces will need booster doses to be protected. Mm-hmm. The most important thing, however, is hygiene. And for hygiene, you need water. And the most important thing to pick up the vaccination program is to have electrical power so you can keep the vaccina cold. You need the cold chain. So all of this can be solved, but it is stopped by the Israeli occupation because they do not allow the repair of the sewage system, the sewage cleaning system, and the removal of the garbage. So this is extremely dangerous, and it is a horrible setback for the healthcare of the people of Gaza. All man-made, all man-made.
Absolutely, all man-made. And you mentioned that polio is extremely contagious. Can it also, and how quickly can it affect Israel too? And could it be like a deciding factor that makes them, change their policy there on aid and actually get aid into Gaza and also fix the sewage system? Because it could affect their own people, could it not?
Well, any human system, any human politicians would say, let's solve this for anyone, regardless of race and gender. But the Israeli have already noted that they are at higher risk to contract, of course, polio. So they have ordered the Israeli occupation soldiers in Gaza to have vaccination. And if they are vaccinated, they should have a booster dose. But mind you, only for the Israeli soldiers. So this is, again, a medical apartheid system where there is one offer for the Israeli soldiers occupying and making the situation so bad as it is, and nothing for the Palestinian civilian population. There was a situation, I believe it was in 2014, after the 2014 attack, where also the sewage cleaning system and the garbage collection was destroyed, and there was poliovirus leaking with the raw sewage into the Mediterranean Sea and drifting with the current northwards to the shores of Israel. And then suddenly there were millions of shekels coming to the water authorities in Gaza to try to repair the sewage system. So yes, the answer to your question is absolutely. This can affect Israel, and ironically, maybe as you mentioned, this could be a changing factor, because already there are Israeli soldiers who have died from fungus infections contracted in Gaza, and the poliovirus does not tell difference between the occupier and the occupied, ironically.
Mads, it's been fantastic to speak to you today on the News Hour. I really hope we speak again and follow how this story develops and speak to you again on this. Mads Gilbert, Professor at the Clinic of Emergency Medicine at the University Hospital of North Norway, and also a person very familiar with the hospitals in Gaza. Thank you so much for your time today.